If you wake up every morning with a heavy, bloated feeling in your upper stomach, a discomfort so familiar yet so misunderstood, over 30% of people worldwide report symptoms like post-meal fullness, pain, burning, bloating, and nausea. This isn't just bad digestion, it's functional dyspepsia, a chronic condition that impacts quality of life, sleep, appetite, and even mood. Now imagine a simple spice-derived oil caraway that may help ease these symptoms. But does it work? Is it safe? Or could it make things worse? Today we explore the truth behind caraway oil claims, what science says, what the risks are, and how to decide whether it's worth trying. Have you ever felt bloated, full, or uncomfortable after eating? Maybe your stomach hurts, you feel gassy, or you get that burning sensation in your chest. If yes, you are not alone. Millions of people around the world experience this regularly. Doctors call this condition dyspepsia, which is a fancy word for chronic indigestion. It's more than just a bad meal. It can affect your mood, energy, sleep, and even your daily life. And here's something interesting. Many people are trying a natural remedy called caraway oil, claiming it can soothe your stomach. But does it really work? And is it safe? Let's find out. What is dyspepsia? Functional dyspepsia is a term doctors use when someone has chronic upper digestive symptoms without an identifiable structural cause visible on imaging or endoscopy. Symptoms commonly include post-meal fullness, early satiety, epigastric pain or burning, bloating, and nausea. It can happen to anyone, and sometimes doctors cannot find a clear cause. This is called functional dyspepsia. The stomach looks normal, but it doesn't work perfectly. These symptoms are often persistent, difficult to treat, and may overlap with irritable bowel syndrome. Current conventional therapies, pump inhibitors, prokinetics, help some but not all patients. As a result, many people turn to complementary and alternative treatment options. Traditional use of caraway. Caraway carum carvi has a long history as a spice and medicinal herb in traditional systems, used for digestive discomfort, gas, cramps, poor appetite, and bloating. Herbalists often prescribe caraway seeds or oil in teas or formulas for stomach complaints. The essential oil contains compounds like carvone and limonene, thought to relax smooth muscles and reduce spasms, giving it its carminative effect of relief of gas and cramps. You might know caraway seeds from bread, pastries, or pickles. But did you know these seeds have an essential oil that can help with digestion? Caraway oil comes from the seeds and contains natural chemicals like carvone and limonene. These can relax your stomach muscles and reduce bloating, acting as a natural gas reliever. In traditional medicine, caraway has been used for hundreds of years to help with indigestion, bloating, gas, mild stomach cramps. Modern science, caraway oil alone or in combination? Here's the key. The strongest scientific evidence doesn't come from caraway oil alone. Instead, clinical studies mostly focus on combinations of caraway oil and peppermint oil, or RAL, especially in enteric-coated capsules for functional dyspepsia. Why the combination? Peppermint oil relaxes muscle spasms and may reduce pain, while caraway oil may aid motility and reduce gas. Together, they may work synergistically. Clinical evidence. What the research shows. Several randomized controlled trials have examined combined peppermint and caraway oil products in dyspepsia. Meta-analysis of RCTs. A major review combining 5 clinical trials involving 578 patients found significant improvement in global symptoms compared to placebo. Improvement in epigastric pain. No significant increase in adverse events compared to placebo. NIT needed to 3 for symptom improvement. This suggests the combination can help short-term symptoms of functional dyspepsia. How it works, the proposed mechanisms. Caraway peppermint formulations may help digestive symptoms through several mechanisms. Smooth muscle relaxation, reduces spasms and bloating. Improved motility, may help clear food from the stomach. Visceral pain reduction, less sensitivity, and irritation. Anti-inflammatory effects could calm low-grade inflammation. However, scientific understanding is still evolving, and the exact biochemical reasons are not fully defined. Does it really work? What science says. Most research doesn't use caraway oil alone. Instead, scientists combine it with peppermint oil, another natural remedy for the stomach. Studies show people with dyspepsia who took caraway plus peppermint oil capsules felt less bloated and less pain after a few weeks. Improvement was seen in 30–50% of people in studies, compared to placebo pills. Side effects were rare and mild, like a little burping or mild heartburn. This means caraway oil can help some people, especially when used safely and in proper doses. Safety considerations. One general safety is caraway oil in typical clinical doses has been well tolerated in studies. Short-term use in adults doesn't show significantly higher side effects than placebo. Common side effects some people experience: burping, heartburn, nausea, mild abdominal discomfort, rare allergic reactions. Populations to use caution: people with gallbladder disease, pregnant or breastfeeding individuals, children, especially under 18, due to limited safety data. Dosage and formulations. Clinical trials use standardized enteric-coated capsules releasing oil in the small intestine, often with 50 mg caraway oil and 90 mg peppermint oil, twice daily before meals. Please don't substitute with generic culinary essential oils. These can be harmful if not formulated for internal therapeutic use. Natural alternatives for indigestion. Caraway is not the only natural option. Other helpful herbs include chamomile soothes the stomach, fennel reduces gas, iberogast, a mix of 9 herbs used for bloating and cramps. Lifestyle changes also help. Eat smaller meals. Avoid fatty, spicy, or heavy foods. Drink enough water. Manage stress, which can worsen. Symptoms. Controversies and misconceptions. Caraway oil alone doesn't have as strong clinical evidence as when combined with peppermint. Not a cure, may relieve symptoms in a subset of people. Quality matters. Unregulated or high-concentration oils can be risky. Always opt for clinically tested formulations. Real-world experiences. Many individuals report relief when using caraway-peppermint combinations, but not everyone responds. Clinical practice suggests effects vary based on symptom severity, diet, stress, and coexisting conditions. Expert opinions are: gastroenterologists acknowledge complementary therapies may help symptom control, but emphasize consulting with a healthcare provider before starting any supplement, especially if symptoms are severe, persistent, or associated with weight loss or bleeding. Practical and lifestyle tips for dyspepsia. Eat smaller, frequent meals. Reduce fatty, spicy foods. Maintain hydration. Manage stress. Consider probiotics. Evidence is emerged. Supplements like caraway oil may be one piece of a broader digestive wellness plan. When to see a doctor. See a doctor if you notice severe stomach pain, weight loss without trying, vomiting blood or black stools, symptoms that don't improve after a few weeks of natural remedies. These could indicate something more serious, not just dyspepsia. Summary. Benefits versus risks. Benefits of caraway oil: reduces bloating and fullness, may ease stomach cramps, generally safe for adults. Risks: mild side effects, burping, heartburn, nausea. Avoid in pregnancy, gallbladder disease, children. Can't replace medical treatment if symptoms are severe. Legal and regulatory notes are: foods, spices, and essential oils are regulated differently than medications. Only specific standardized products studied in clinical trials are supported by evidence. Before trying caraway oil or any supplement, discuss symptoms with your clinician. Consider keeping a symptom diary. Evaluate other lifestyle and dietary triggers. Choose products with clinical evidence, proven dosage, and safety profiles. Caraway oil is a safe and natural option for many people with indigestion, especially when combined with peppermint oil. It won't cure every stomach problem, but it can help you feel better and enjoy meals again. Start slow, pay attention to your body, and combine supplements with healthy lifestyle habits for the best results. Caraway oil is not a silver bullet, but for many people, it can be a helpful tool when used safely, intelligently, and under medical guidance.